We're going to see the schizoaffective disorder. Schizoaffective disorder needs to be distinguished from psychosis, from mood disorders. Mood disorders include schizophrenia, bipolar disorder, and major depressive disorder. So, remember that in the mood disorders, in any one of these, the patient can have these psychotic features. For example, in bipolar disorder, in the manic episode can have a psychotic episode, or patient with schizophrenia present with hallucinations, psychosis, and patient with major depressive disorder can have major depressive disorder with psychotic features. So we need to distinguish that, because a schizoaffective disorder needs to have both a mood disorder that could be, for example, bipolar disorder or major depressive disorder, plus the psychotic episode. Now, the psychotic episode should occur out of the mood episode. So, in order to assure this, in the diagnosis, not only is mood disorder plus psychosis. They can be spaced. We don't need that the psychosis occur at the same time. Actually, we need this plus at least 2 weeks of psychosis without the mood disorder. Because schizoaffective is mood disorder and psychosis. In one time we have one, in another time we have another. Most of the time has the mood disorder, either bipolar or major depressive disorder. But at least 2 weeks present with psychosis, but without the mood disorder. This is what will differentiate, for example, bipolar disorder with psychotic features, because in the psychotic feature, in the bipolar disorder, the patient presents with the psychotic features while the patient is having that mood disorder, that bipolar disorder, as part of a manic episode. But in schizoaffective disorder, the patient presents at some point with bipolar disorder, with some manic episode, and in this point only with psychosis. So at least 2 weeks of psychosis without the mood disorder, even though most of the time the patient would spend on this mood disorder, either bipolar or major depressive disorder. And the treatment will include antidepressant medications or anticonvulsive drugs. And if any one of these doesn't work, then we go to the antipsychotic medications.